Terrifying medical treatments. Yes, friends, this time we're making a heavy start. In the old days, when you had pain somewhere, had a cavity, had a wound or something, you could just go to the pharmacy and buy morphine made from opium and drink it straight down your throat. There was no limit. Of course, what's the problem with having such an addictive thing everywhere? Well, of course, everyone became addicted to it, whether they wanted to or not. It was so scary that by the end of the 1800s, 1 out of every 200 people in America was a morphine addict. Most of them were wounded veterans of that damn Civil War that ended a few decades ago. The market was saying we need something that's less addictive but still powerful. Right at this point, a German pharmaceutical company emerged. BA, or as we know it better, Bayer, said let's go produce something in the laboratory. To give credit where it's due, British chemist Charles Romley Alder Wright had done the actual work in 1874, but Bayer was going to be the one to put it on the market. German chemist and Bayer employee Felix Hoffmann took morphine and did his chemical magic and turned it into diacetylmorphine. Keep acetylation in mind, you'll need it in a moment. So what do all these nonsense terms mean? Let me explain. Do you see those two acetyl groups? Thanks to them, this thing gets into the blood much faster than normal morphine, and bam, it takes effect immediately. The first experiments went wonderfully. Patients said this is great. Felix also named it heroisch, meaning heroic or powerful in German. But in 1898, Bayer brought it to the stage with a slightly different name, heroin. The product was marketed as a safer alternative to morphine that doesn't cause addiction. The Boston Medical Journal explicitly said there is no danger of habit formation. Wow, what great irony this is. Because morphine had initially come out with the same thing. They were saying it's safer than opium and doesn't cause addiction. But instead of being safer, each time more powerful and more addictive versions were coming out. Isn't that madness? Anyway, Big H was everywhere now. Tablets, lozenges, syrups, etc. Besides pain relief, they said the syrup was also beneficial for tuberculosis and pneumonia. These were very common at that time. They even gave it to children for coughs and such. Both the sick child felt better and the parents did. But they're not coughing anymore, right? For years, Bayer spread this plague to the world. A new generation of addicts was raised. But Bayer's scientists didn't realize that the body was actually converting this medicine back into morphine. Did you remember acetylation? The body was doing deacetylation and converting heroin molecules back into morphine molecules. Actually, patients were taking stronger, faster morphine that had taken on the appearance of medicine. Strange consumers? Their lives were turned upside down. Short term it was nice, that euphoric feeling and all, but long term it was incredibly terrifying. Doctors were saying everyone wants more doses. Obviously it's addiction and tolerance. Even if the initial illness passed, people wanted their doses. Those who couldn't get them suffered terrible withdrawal, restlessness, bone and muscle pain, inability to sleep, nausea, trembling. At the extreme end, of course, breathing stopped, meaning complete shutdown. When a lot of backlash came, Bayer stopped production in 1913. Coincidence or not, the next year the Harrison Narcotics Act came out. They removed all diacetylmorphine-based things from the shelves. It only became available with a doctor's prescription. It continued like this for a while, but in 1924 it was completely banned. It had to officially be a #1 drug until they finally said it has no medical use. Mental illness has always existed. We're still learning even today. There's been research since ancient times, but it really accelerated after the mid-1800s. Of course, mistakes can inevitably be made at the beginning of any research. You have to mess up a lot to learn. But some mistakes aren't seen as mistakes at first. Here you go, Dr. Manfred Sakel. The man's simple accident was interpreted as success, and many people paid the price for it. Trained as a psychiatrist at the University of Vienna, Dr. Sakel from Austria came to America in the late 1920s. He would deal with substance addiction, like morphine addiction, but instead of giving syrup, he gave the person insulin injections. Insulin was like a metabolic sedative. It surprisingly made trembling addicts sleepy. It was easy to manage, but they weren't considered cured. Then they would tremble the same way. Anyway, Dr. Sakel must have drunk a big glass of idiot juice one morning, because he accidentally gave the patient too much insulin, and the patient went into a coma. Damn it, don't die on me. He managed to bring the patient back with a glucose injection. But then something hard to believe happened. The patient, who was normally always agitated, showed no withdrawal symptoms, and their mind also cleared up. Apparently turning the brain off and on had worked. It was like a mental reset. If it worked once, it must always work, said no good doctor ever. But our man expanded the business with this breakthrough. Now he standardized the process and tried it on schizophrenia patients, a serious illness that had no treatment at that time. Under insulin shock treatment, patients were put through tough coma cycles, 5-6 times a week, each coma about 1 hour. This process lasted for weeks. Patients were exposed to up to 60 comas over several months. The worst cases lasted over 1 year. When patients were conscious, they experienced more sweating than normal, saliva, agitation, and many went through convulsions in an excessive manner. Despite all these obvious side effects, Dr. Sokol published his findings. 70% of patients completely recovered, he said. This started the madness of other doctors also restarting schizophrenic patients, but repeated hypoglycemic comas didn't provide much benefit to the body. Long-term effects: severe memory loss, decreased attention, slowed brain. People struggled extremely with learning and thinking. At the extreme end, of course, there were deaths. According to statistics across America, death rates from treatment reached 5% in some places. Well, that's not so much, you might say, but when thousands of patients' brains are being forcibly restarted, the numbers add up. There were hundreds of unnecessary deaths because of terrible research. Insulin shock treatment was done until the 1950s. It went out of fashion when antipsychotic drugs came out. They were cheaper and safer. By the 1960s, it was completely abandoned. As for Dr. Manfred Sokol, his heart left him in 1957. He died of heart failure at age 57. This beautiful-looking stone is called calomel, and is the stone responsible for the deaths of thousands of people in human history. A simple compound, but calomel, meaning mercury chloride, was used as treatment for centuries. Arab alchemists passed into history with golden letters as those who documented it in the early Middle Ages to treat syphilis. But Swiss doctor and double-chin enthusiast Paracelsus advanced the research in the 1500s. He noticed the compound expelled black bile from the body. It made you vomit and defecate. You know, for thousands of years the valid medical theory was the Hippocratic 4 humors theory. I know I mentioned it before, but let me explain again. There are 4 main fluids in the body: blood, phlegm, yellow bile, black bile. If you're a healthy individual, these are in balance, but if one gets disrupted, you catch an illness. So you need to bring them into balance. You'll bleed a little, cough up green phlegm, or empty your dragon. Each one is a valid method to put things in order. Although Paracelsus could see benefit in calomel's purgative properties, he was actually against it. He said it was only a last resort, because according to what he observed, the risks far outweighed the benefits. Even in the 16th century, it was known that mercury was problematic as a treatment. Pure mercury had been used medically since ancient times, and smarter scientists had documented its not-so-pleasant effects on the body. Hair loss, tooth loss, fatigue, dementia, and death are among the effects of heavy mercury use. Death is the worst of these. But who cares about severe warnings while making money? Skip those years. Come to the 18th and 19th centuries. American and British physicians were distributing calomel like candy. Refined calomel was a tasteless, odorless white powder, a fascinating oral medicine. It was marketed as a cure for syphilis, gout, bronchitis, cholera, constipation, even ingrown toenails. Guess what? Calomel wasn't the greatest idea as a medical treatment. Severe bodily expulsions led to serious dehydration problems in patients. Not only that, some patients were also bled along with mercury treatment. So in the attempt to balance their humors, some patients fell to dangerously low body fluids. This led to these little raisins experiencing hypovolemic shock. Their bodies actually couldn't provide adequate levels of blood to their organs. It invited problems like rapid heartbeat, extreme weakness, and complete organ failure. But according to the brightest medical minds of that time, this only meant the treatment was working. In the 18th century, one of the leading medical authorities, Scottish William Cullen, saw these symptoms as nervous energy separating from the body. According to his logic, this would eventually lead to the cure of the disease. If there were deaths, the fault wasn't in calomel, but in the disease. Still, he warned against excessive use of calomel. He only recommended minimal doses. After all, the dose makes the poison. But one Scottish doctor can't dissuade another Scottish physician, Benjamin Rush. Besides being a successful and world-famous doctor and philosopher of his time, Benny Rush also signed the American Declaration of Independence.
He's technically considered a founding father, but this doesn't absolve him of his mistakes, and he made more than one. For example, the use of calomel for yellow fever treatment in the 1790s. He took Cullen's minimal dose recommendations and painted them with his own temperament. He took everything to the maximum. Instead, Benjamin Rush practiced depletion therapy, with a combination of calomel in heroic doses and excessive bloodletting. The logic being, if there's no fluid in your body, there can't be bad fluid either. You can't even call this treatment. It's assumed to have resulted in thousands of deaths throughout the 18th century. But egotistical physicians aside, calomel was nevertheless on the medical stage. Fortunately, its fate was determined in the 20th century, only at a frightening cost. Instead of being prescribed alone, calomel was used as a component in various consumer products throughout the 1900s. Cosmetics and baby products, especially teething powders used when mischievous babies were teething. Teething powder was applied directly to the sore gums of little future taxpayers to relieve pain and calm them. But then mercury did its thing and produced a horrifying side effect, acrodynia, a fatal mercury poisoning that causes the skin to turn pink and painfully swell and peel. According to the Western Journal of Medicine, the death count from calomel-induced acrodynia reached 585 from 1939 until the ban in 1948. Even survivors experienced lifelong neurological damage and devastating developmental disorders. Calomel is unfortunately still used today, but instead of putting Tiny Tim in a small grave, only as a scientific tool in the field of electroanalysis. May God be with us all. Have you ever copied someone else's notes in class, then realized too late that you made a mistake, taught yourself the wrong thing, and now you look like a complete idiot? This is what a group of European people did in the 12th century. Ancient Greek and Arabic texts were pointing to a substance used as an effective remedy for many diseases. The Arabic text called the substance mumia, from the Persian word mum meaning wax. Mumia was a natural black tar found around the Dead Sea in the Middle East. This black liquid, also known as pitch or bitumen, was most often applied directly to wounds to stop excessive bleeding and encourage healing. It had natural antiseptic properties. Powdered bitumen could be diluted with wine or vinegar and used for headaches, fever, or a grumbling stomach. This is all nice and pleasant, but when 12th century European scholars were translating Arabic texts into Latin, some wrong pieces of the puzzle were being forcibly put in place. This happened with the translation of mumia. The way the text described the substance wasn't entirely clear. Some clues were pointing to mummified corpses from ancient Egypt. Let me open a parenthesis. In the New Kingdom and late periods of ancient Egyptian history, the mummification of corpses actually used pitch in the process. But instead of pitch, the translators misunderstood that mumia referred to the black tar-like substance inside corpses and mummified bodies. Interesting fact. This is why we call mummies mummies. A simple mistranslation. When the translators saw human corpse and remedy in the same medical text, things went off track. Look, the idea of consuming remains for health wasn't new. Actually, medical cannibalism existed since the past. One example is the ancient Roman practice of drinking gladiator blood to treat epilepsy. Even in China, Tang Dynasty Emperor Wuzong ate human flesh to extend his life. So although it sounds interesting, it wasn't outside the realm of possibilities.
But this mistake started a quite lucrative craze. After the mistranslation was published, European apothecaries flooded Egyptian merchants with orders for original ancient remains. Thus the mummy trade of the 12th century began. Graves were opened, tombs were looted, cold corpses were extracted for cold cash, but for every market a submarket grows. With high demand and limited mummies, fake corpses were being created. Recently deceased people were being turned into cash as authentic remains. We'll return to this in a moment. For use as medicine, mummies were broken apart, crushed, turned into powder. The powder could be taken orally to treat everything from internal bleeding to full depression. But if chewing mummy wasn't your style, the powder could be snorted up your nose. Ridiculously, this was used to treat nosebleeds. Of course, if not powder, it could be mixed into various ointments and pomades. Smear that shit all over yourself, it heals open wounds. The problem, as you can guess, was when it didn't work at all. French Renaissance surgeon Ambroise Paré found the practice barbaric and evil. He said the treatment could do more harm than good, because this was nothing more than dead, rotten cadaver flesh. He saw patients swallow the powder. He observed tremendous vomiting and severe stomach pains, and all of it was true. Medical experts noticed considerable reactions in the powder. Now, if we address the fake corpses, this was an insult to the disaster. These corpses were generally newly dead from disease, mummified and prepared to resemble a real dusty, showy corpse. So instead of eating ancient Egyptian thin sticks, people might have been chewing Monty's mixture who died of malaria. Fortunately, scholars in the Renaissance decided to re-examine the original Arabic text and noticed the mistranslation, rejected mummy powder as medicine, and hammered the final nail in the coffin for the terrifying treatment. Ah man, lobotomies. Probably the poster child of horrific medical treatments. They're definitely brutal and will definitely cause you to pucker up a hole or two. I hope you didn't dive too deep with this video, because we're going back to mental health. And who better to take the sharp short end of this stick than schizophrenics? According to our insulin shock treatment section, schizophrenia was a big problem in the early 1900s. Besides Dr. Sokolo's super sleepy sit-stand contraption, nothing was being suggested as a possible treatment. In 1935, a Portuguese person was determined to change all this. Antonio Egas Moniz, a fancy name for a horrific-looking fellow, looking like a melted Lego figure with slicked hair and absence of skin pores, Egas Moniz placed himself in the front lines of modern psychosurgery. He thought mental illness was simply the result of abnormal nerve connections in the frontal lobe of the brain, basically the human version of bad cable management. He developed this theory by researching other work in the field. For example, physiologists John Fulton and Carlisle Jacobson removed a nervous chimpanzee's frontal lobes, made it much calmer, although it was somewhat more drooling. Neurologist Richard Brickner recorded the complete personality change of a man whose frontal lobe was surgically removed following tumor discovery. Along with other lunatics, Moniz presented his case and requested permission to test his theory. He got 20 patients suffering from anxiety, depression, and of course schizophrenia, maybe all three. Due to physical complications, Moniz couldn't perform the surgeries himself, so his neurosurgeon friend Pedro Lima dealt with the matter, or more precisely with the white matter. White matter fibers are critical components of our brain, the main pathways for information sharing between different parts of the brain. Their existence enables us to learn, think, express emotion, breathe, and move. So let's disrupt all this with a sharp swirling needle and pure alcohol sprays. This should definitely work. And according to Moniz, it did. Of the first 20 innocents who went under the needle, 7 recovered, 7 more improved. The remaining 6 were unaffected. A 63-year-old female patient diagnosed with paranoia, hallucinations, depression, insomnia, and anxiety got rid of almost most of her symptoms with a few alcoholic sprays to the brain. For this discovery, Moniz eventually received the Nobel Prize in Physiology or Medicine in 1949, but across the Atlantic there were a few American neurologists eager to bring Moniz's technique to America. In 1936, James Watts and Walter Freeman Jr. thought this medical marvel was the coolest thing since sliced bread. They were successful in recreating the procedure, but they optimized the route. They created the transorbital lobotomy. Why would you drill a hole in the skull when we have 2 fascinating eye sockets to get in? In one hand, a sharp surgical instrument shaped like an ice pick called the orbitoclast, and in the other, a damn hammer. You're already shuddering. The orbitoclast was hammered into place behind the eye socket, breaking the thin bone layer and creating a shortcut to the frontal lobe. The sharp instrument was then gently swung left and right, cutting most of the frontal lobe connections before being removed. Freeman and Watts's method was cheaper, more practical, and if you believe it, more reassuring for the patient. Initial results were fascinating. Patients had reduced psychotic symptoms, more docile behaviors, and generally decreased pain. It sounded nice, but with what we know now, after decades of medical advancement, this was something that could be expected. Look, when you destroy most of the information pathways that regulate mood, emotion, and cognition, you create people who are dull, emotionless, and cognitively unable to be full. This is exactly what happened. If they survived the surgery, patient follow-up reports showed that many became indifferent, had marked decreases in motor skills, lacked creativity or sense of personal identity. They were no longer human, they just existed. Although psychological symptoms decreased greatly, so did their quality of life. But of course this didn't stop neurosurgeons from sticking ice picks into brains. According to them,
Couch potato people were better than most mental hospital patients. From the late 1930s until falling out of favor in the 1970s, over 50,000 lobotomies were performed in the U.S. Dr. Freeman performed nearly 3,500 of them with his own hands. It was never officially banned, but transorbital lobotomies are only done for extremely rare cases nowadays, so you don't need to worry about your barrel being drilled.